As thousands suffer the long-term effects of COVID, experts ask, are lingering symptoms like shortness of breath and chest pain actually proof the disease is contributing to undiagnosed heart problems? Dr. Sarah Mason-Whitfield wasn't too worried when she tested positive for COVID-19 in March last year. The London-based GP, 46, discovered she had the virus after taking a routine lateral flow test just days before. She'd received her second Pfizer vaccine dose. "I wasn't feeling great after my jab, so I didn't notice I was ill at first," she says. Within days, the married mother of one's symptoms worsened. "I was incredibly fatigued and had really awful muscle pains," she says. She consigned herself to bed, hoping that rest would help. But while the muscle pain eased, after 2 weeks, new symptoms began to plague her. "I realized I couldn't sit up in bed for longer than 10 minutes without feeling really dizzy. And when I tried to stand up, I felt a tight upper chest pain." As the weeks went on, the dizziness and chest pain did not disappear. In fact, Dr. Mason-Whitfield, who had by then placed herself on sick leave, realized it was getting worse. A family doctor with decades of experience, she began to consider her own medical diagnosis. "If I tried to do simple tasks like wipe the kitchen table, it would set it off. It felt like someone was tightening a belt around my ribs. And the pain would shoot up into the back of my mouth and my teeth." They were classic cardiac discomfort, the kind of symptoms you'd expect with a heart problem like angina or something worse. Dr. Mason-Whitfield went to her local rapid access chest pain clinic, an NHS service that allows people with chest pain who might be at risk of heart attack to get urgent care. However, she was refused an appointment. "I was told since I'd had COVID, I didn't qualify for the clinic, because chest pain was such a common symptom of the infection." Still suffering in June, the NHS doctor booked a private appointment with a heart specialist. There, she was put through a number of common heart tests, including an angiogram, a special type of X-ray that uses dye injected into the blood to allow doctors to look at the coronary arteries, the blood vessels that supply the heart. Problems in the coronary arteries are often associated with conditions such as heart attack and stroke. An angiogram can also flag up angina, chest pain caused by reduced blood flow to the heart muscles. But Dr. Mason-Whitfield's angiogram showed no problems, her coronary arteries were clear. She wasn't satisfied. "My symptoms were so bad that even a gust of cold wind, making me tense up, would set off excruciating chest pain. I knew something was seriously wrong." Her private cardiologist next suggested a test known as a stress perfusion MRI, which examines the blood flow to the heart both at rest and under stress. It's a complicated procedure and is not available at many NHS hospitals. Luckily, Dr. Mason-Whitfield was able to pay the £300 cost.